If you're pregnant, you likely know the importance of eating a healthy diet. Eating right during pregnancy can make for a healthy, happy newborn. After all, the food you eat is your baby's main source of nutrition, and smart diet choices can help promote a baby's growth and development. A diet rich in protein, fruits, and vegetables is important when eating for two. But what foods and drinks should you be avoiding? Number 1, coffee. Caffeine is a stimulant, meaning it raises both blood pressure and heart rate, and both of these effects can be especially detrimental during pregnancy. While large amounts of caffeine are generally discouraged, many doctors say that one 12-ounce cup of coffee a day is perfectly okay. Each pregnancy is different, however, and it's always best to talk to your doctor first. Number 2, soft cheese. Get ready to say goodbye to blue cheese, brie, and even feta for the next 9 months. Soft cheeses have a higher risk of being unpasteurized and are therefore more likely to carry a bacteria called Listeria. The illness caused by the bacteria is called listeriosis, and pregnant women are 13 times more susceptible to it than most. It can cause death of the mother, death of the baby, and even miscarriage without proper treatment. If you begin to show flu-like symptoms and have consumed possibly unpasteurized products, seek medical attention immediately. Number 3, high mercury seafood. Mercury is an element naturally found in some bodies of water. Over time, mercury deposits can collect in the bodies of the fish that live there. Because fish that live longest contain the highest levels of mercury, the types to avoid include shark, tilefish, swordfish, and king mackerel. White albacore tuna should be limited to 6 ounces per week. Number 4, sushi. Both sushi and sashimi are made with raw fish, and while mercury can be an issue for these items as well, it's the uncooked part that really makes them ones to avoid. Uncooked fish can carry parasites, which can harm both mother and baby. Number 5, raw dough. Eating raw batter should be avoided if you're expecting. Cookie dough, brownies, and cakes are all made with raw eggs, which can contain salmonella before baking. Salmonella can cause nausea, vomiting, fever, and chills, among other nasty symptoms. Number 6, raw vegetable sprouts. While most bacteria on raw veggies and fruits is easily washed off, bacteria often gets inside of the sprout's shell before it begins to grow, making it almost impossible to remove. The US FDA recommends never eating sprouts raw and cooking them thoroughly to reduce the risk of illness. Number 7, alcohol. Arguably the most important item to avoid during pregnancy. Alcohol can cause irreversible damage to a developing baby. High blood alcohol levels can lead to fetal alcohol syndrome, preterm birth, and even miscarriage. Make sure to speak with your doctor about a healthy pregnancy diet and what other foods and beverages you should avoid when you're expecting.